Hi, I'm Dr. Obermeyer, and the purpose of this video is to discuss Bankart and Sachs lesions. Bankart and Sachs lesions are a result generally of a traumatic injury where the shoulder dislocates or the ball is forcefully moved from the front of the socket and injures the tissue called the labrum, as well as can occur as a result of an injury to the ball known as a Hill-Sachs lesion. This spectrum of abnormality can lead to what we call recurrence, where the shoulder is unstable as a result of the injury to the socket as well as to the ball of the shoulder. Shoulder instability as a result of a Bankart or a Hill-Sachs lesion can lead the shoulder to be at risk of dislocating or subluxing or shifting on itself with many sporting or overhead or positioning activities with the arm, leading to what we call apprehension, pain, or limitation of activities. In some cases, considerations for treatment are not only the uneasiness with the instability or apprehension with the shoulder joint as a result of the Bankart or Hill-Sachs lesion, but also the risk of recurrence of the instability event. Each time the ball dislocates out of the socket, the injury to the structure of the shoulder is worsened, where the Hill-Sachs lesion can progressively enlarge, as well as the bone, that's the front portion of the socket, also known as the glenoid, can become eroded and deficient. The treatment options for Bankart and Hill-Sachs lesions depend in large part on the patient's anatomy, the type of tear and injury to the ball known as the Hill-Sachs, as well as expectations for functional recovery. There are certain risk factors that place certain patients with these injuries at a very high risk of having ongoing difficulties with the shoulder. Some of them include ligamentous laxity, a particularly young age, as well as high activity demands or sporting demands, where there are high loads that are frequently applied through the shoulder. In some individuals with more limited activity demands or in whom the structural nature of the injury is milder, a course of physical therapy and strengthening of the surrounding muscles of the shoulder may be appropriate. However, the gold standard treatment for many patients with Bankart and Hill-Sachs lesions is an arthroscopic repair, where a minimally invasive procedure allows restoration of the anatomy of the labrum as well as the ligaments to promote a full functional restoration of the stability of the shoulder for return to activities and sporting. The surgical recovery from Bankart and anterior instability repair is generally relatively straightforward. A sling is recommended for several weeks to let the tissues heal, during which time simple activities are initiated with the hand in front of the body, including for things like working on a keyboard, a phone, or feeding oneself, as well as physical therapy is initiated during the time that the sling is worn. Once the sling is discontinued, full range of motion is generally achieved, with strengthening between 2 and 3 months following the repair. For the ensuing several months, a discussion is had with a rehab protocol that is tailored to the patient's activity demands and sporting activities, as well as the time frame for season in sporting athletes. Thank you for your interest in Bankart and Hill-Sachs lesions, and please review our website for more information.